Wendy Kandell may look like a normal 16-year-old, but for most of her young life, she has experienced pain, a stabbing pain in her stomach that is difficult to bear.
It's absolutely terrible. Like, I'm not one to cry. Like, I am extremely strong. Yet last night I was bawling in bed because it was just like, I can't do it.
The Florida teen had many tests over the years: CAT scans, MRIs, blood tests. No one could find anything wrong.
It's the hardest thing I've ever experienced because I'm constantly being told I'm crazy, that I'm a drug addict, that my pain isn't real, that I'm just making all of this up because I like the attention.
What Wendy has is a condition called chronic pancreatitis, a condition which 20 to 30% of the time eludes traditional testing.
Can you imagine walking around with terrible abdominal pain? You can't be in school, can't function normally like a teenager, and so your life falls apart and people tell you, well, we can't find anything, you got nothing. So giving someone a diagnosis has a huge impact.
To make that diagnosis, Dr. Steve Freedman, head of one of the nation's leading clinical and research pancreatitis programs, relies on a complete medical history and advanced testing techniques.
Here at Beth Israel Deaconess, we do this called secretin pancreatic function test, upper endoscopy procedure. We can rule in or rule out the diagnosis of chronic pancreatitis.
Having a diagnosis allows for proper treatment. Medications and nerve blocks can work on the pain. Holistic treatments like yoga and meditation can also have an impact. Surgery, however, is not an option for many.
Let's say someone says, go ahead, doctor, just cut out my whole pancreas. Well, you have a 50% chance you'll have your exact same pain of chronic pancreatitis. So even if you remove the whole pancreas, your brain is still getting the sensation that my pancreas hurts.
As long as we are within the circle, we are targeting the right part of the brain.
However, that knowledge is leading to possible new therapies. Wendy is having transcranial magnetic stimulation, or TMS, in a carefully designed clinical trial supported by a grant from the National Institutes of Health. One type of TMS has already been FDA approved for treating depression, but the idea to use it to treat pancreatic pain actually lifted off when gastroenterologist Dr. Freedman and noted neurologist Dr. Alvaro Pasqualeone found themselves chatting about the disease while waiting for a delayed flight.
I'm a brain doctor. I know nothing about the pancreas. Steve knows a lot about pancreas, but never would link up what we know about brain changes in that setting. And so as we were talking and interacting and offering each other information from our vantage points, we realized all of a sudden, look, there is a possibility of actually leveraging what is known from one field and the other and putting it together.
The idea is to target networks in the brain, connections that aren't working properly, and send electrical current through the skull to get them working again. Patients start by undergoing a special type of brain scan to pinpoint the exact region of the brain that controls the pancreas.
And we established that in her, like in other patients with chronic pancreatitis, there is an abnormality in that activity. There is too little inhibition. The area is too ramped up.
TMS is targeted to hit that area, calming the brain networks that register pain. Wendy has a series of 2 20-minute treatments each day for 5 days.
It was the greatest feeling in the world. After the first 4 treatments, I was pain-free, and it was incredible.
But the pain returns after a while, and every 3 months, Wendy is back for more treatment. While there is still much to learn about the impact of TMS on chronic pancreatitis, Wendy remains positive, looking ahead to better times, and one day becoming a doctor herself.
Going out with my friends, going to college, everything like that, becoming the best pancreatologist in the world.
As for Wendy's heroes at BIDMC, they continue their mission to help each patient who walks in the door.
There are, though, a lot of potential hope, some new avenues. We still have a long way to go, but at least we can potentially give someone the diagnosis. Is it chronic pancreatitis? And if so, what's a thoughtful plan to really help that person and their family get back on keel and have somewhat of a normal life back?